Well, this is Tim Rowan from Home Care Technology Report, and we are broadcasting this interview today from the American Telemedicine Association meeting in San Antonio. I'm joined by Jason Goldberg, the president of Ideal Life. Jason, thank you very much for being with us today.
Thank you. Wonderful to be back.
Yes, it's been a year. I'm sure that some things have happened since we talked last, but why don't you go ahead and start, for those who might not have seen our interview last year, and give us the background about Ideal Life.
Yeah, I'll give you a little sense about what we do, kind of a refresher. Ideal Life is really about delivering real-time health information on demand. So we're really about delivering information that is manageable, delivering it to the right people at the right time, in the right place, in the right format. And it's really about the right information in between physician visits, in between interactions with the nurse, healthcare professionals, information for caregivers to better understand and participate in long-term chronic condition management.
So primarily you would describe yourself as a home telehealth device provider.
Correct. As well as information management services.
Information management services. Are you exclusively in the home healthcare arena, or do you go beyond that?
We go beyond that. It's been quite interesting. Again, that's why our focus is really delivering products that communicate real-time health information, as well as, when we talk about information management services, communicating that information in a method across the entire care continuum. So if it's family members participating in caring for older parents, grandparents, or children, diabetics, asthmatics, as well as providers, healthcare professionals, home care, physician groups, the payer community, hospital networks, trying to deliver programs to better understand and manage conditions or disease states for their patients, their members, as well as employer groups, community health clinics in the community setting as well. So it's quite an exciting time for us when we talk about the landscape and the availability of these types of technologies and services where we come from as a company.
Now, as you told us last year, you have changed the model a little bit from the familiar bedside remote monitor that I have been writing about for a number of years. Can you tell us about your primary product line?
Yeah, so Ideal Life is really about long-term sustainable chronic condition management. And when we focus on that, we're really about bridging the information gap between health consumers and providers. And in order to do that, we took a very different approach, unlike bringing the hospital in the home, or unlike replacing the physician visit or nurse healthcare professional interaction. It's about using products to assist groups in delivering the information. So when we talk about that, we actually designed and developed consumer-friendly products or medical devices that are familiar to individual patients and health consumers. So those devices are plug and play, very simple to use, a blood pressure monitor, a scale, that's empowered with wireless communication technology to automatically communicate data. So it's really about that assisted component, as well as opening up an interactive window of communication and sending data down through those devices, messages, even images, to further engage and allow feedback to happen in that loop as well.
Well, let me start with the device. You're talking about wireless vital signs, weight scales.
Correct.
That can be placed around the home or the assisted living center, wherever is convenient.
Correct.
But so what is the aggregation unit? Where does that sit?
So information, the focus for Ideal Life has always been around the point of engagement and interaction with the device. So we have smart, intelligent medical devices at the front line where individuals are actively engaged with their disease process. So a scale, I step up on a scale and wirelessly communicate the information. I might pull a blood pressure cuff out of my night table stand and take a reading. I might have a wireless pedometer. I'm interacting with the device. So the key for us was always understanding where individual consumers were engaged with the product. Wirelessly, the information is communicated remotely to our information management engine. Now, it's been a very exciting and interesting time when we talk about the channels of communication that are available. So as a company, we focused on the user experience and took a very flexible approach to communicate the information across multiple channels. So we actually designed a flexible approach in communicating the information. So we have a wireless hub, a gateway, that typically is plugged into a telephone line, or for the small but growing demographic, probably no longer small anymore, no longer using telephone lines, they can plug it into an internet connection. Now, an exciting product that we're featuring here that we're going to be releasing in the fall is our cellular hub, which in a lot of international markets, rural communities, especially Medicaid populations, some other interesting groups where you often won't have a telephone line or an internet connection, you don't have to plug it into anything. So your wireless hub is truly wireless and allows for that freedom of communication. We also can communicate through cell phones as well. So true freedom of mobility and flexibility on that end.
So the patient's interaction is with the medical device itself, the measurement device.
Exactly.
And they're not concerned at all with the aggregation unit. You had a name for
it. The IDLife pod.
The pod.
Yes, the IDLife pod.
But then the information, that's the other side of your business. The information is available, I assume, on the web to selected people that are keeping an eye on that particular patient.
Exactly. And again, as appropriate to the program that is being implemented. So we also took a very flexible approach, and I think that's one of the most important parts of our system, is our information management delivery system, where it includes our own web-based applications for groups that don't have, or individuals that don't have their own health record applications. So we have our own personal health record application, fully integrated with our messaging interactive model and different alert engines, recording parameters, where individuals can have a richer experience, gain a better knowledge, understanding of their own condition online through the IDLife personal health record. Healthcare professionals today are using IDLife's case management tools and health record applications if they don't have their own information systems in-house. And even when we talk about the highest level, third component are reporting tools that allow groups to constantly assess and evaluate their populations and understand exactly what's happening with their systems themselves. Now, groups that have their own health record applications, we integrate directly into those as well.
That was
going
to be my next
flexible
question.
Approach.
You can communicate outside of the IDLife world.
Exactly.
And with other patient records.
Correct. And that was critical for us because just like on the health consumer side where patients, members, individuals are interacting with the devices, we want to be in line with existing life flow, their routine behavior. On the implementation side, both for caregivers, family members, patients, health consumers, and providers in the payer community, we don't want to force them to use our applications. If they're already utilizing their own health record applications, we want to allow groups to better participate, be more informed, and understand with the real-time information, the right information, what's going on with their populations.
Before we run out of time, I want to give.
Yes,
I want to find out what this is that you brought with you.
I brought with me a little show and tell. This is something that I'm very excited about that we're launching in the summertime. It's our wireless pedometer, and again, we are all about mobile connected health. And as we start venturing out into a lot more of the wellness programs, and actually one of the first that we're going to be launching is an innovative pediatric obesity program. Now, what's different of our IDLife pedometer, which we call the IDLife Step Manager, is it's all about mobile connected health and wellness. Fully integrated to our information management system, integrated already with Facebook and Twitter. Again, when we talk about allowing groups to participate with their existing applications or using the IDLife application, wherever they are, they can now be connected so we can create an environment of friendly competition, motivating and encouraging individuals to keep fit, have fun, and stay healthy.
That's a great idea. Pediatric obesity is one of the biggest problems that we have today.
Exactly. And again, fully connected, so I can receive messages on my pedometer. Maybe my friend last week or my colleague just broke my record of the number of steps that I took last week or lost a little bit more weight. I'll get that notification on my wireless pedometer. And vice versa, if I reach my target threshold, all my friends on Facebook will receive a notification that they better pick up the pace and do just as well as I'm doing.
Hey, that sounds great. Make a game out of
Exactly.
keeping kids healthy.
And it's about engaging them,
Yeah.
feedback, and connected health. And I think we could do a lot of great things together with
That's
that.
great. We are out of time, and I want to make sure that people can find you. So talk
Yes.
to us about your website.
So please come visit us online, idealifeonline.com. That's www.idealifeonline.com. We have a wealth of knowledge and information on programs that we've implemented and that we enjoy sharing with others, because it's really about, I think, a trend towards better engaging and empowering individuals with the right information.
Terrific.
Always a pleasure.
Thanks very much for joining us. Jason Goldberg is the president of Ideal Life. He joined us here at the ATA annual meeting in San Antonio. I'm Tim Rowan. Thanks very much for joining us.